You know, when you hear about climate change, your mind probably jumps to polar bears or melting glaciers. But what if the biggest, most immediate threat isn't to the planet, but to our own health? Today, we're going to dig into the evidence showing that climate change is way more than an environmental problem. It's one of the most serious public health crises we face.
Yeah, let's just start with that for a second. The most important threat for humanity. That's not a small statement, especially coming from a UN climate summit. This sets the stage perfectly, because it's not about some far-off future. It's about our health, right here, right now.
So how exactly does a warming planet mess with our bodies? Well, before we get to the symptoms, we have to diagnose the underlying problem. And it turns out the planet is running a pretty high fever.
So what are we even talking about here? At its heart, climate change is just a huge, long-term shift in the weather patterns we've always relied on. For thousands of years, things were pretty stable. But in just the last 50 or 60 years, that stability is gone, replaced by change that's getting faster and faster.
And the engine behind all this is something you've probably heard of, the greenhouse effect. It's actually a pretty simple process. Step 1, human activities, mostly burning fossil fuels, pump out gases like CO2. Step 2, those gases act like a thick blanket, trapping heat in our atmosphere that would otherwise escape. And the result? Well, the whole globe starts to warm up.
So how warm are we talking? Well, projections show that by the end of this century, the average global temperature could jump by anywhere from 1.8 to 4 degrees Celsius. Now, I know what you might be thinking. A few degrees, what's the big deal? But when you're talking about the planet's average temperature, even a tiny shift creates massive, dangerous, and extreme weather on the ground where we live.
Okay, so the planet has a fever. What are the symptoms? Well, the first one is brutal and direct. The heat and the havoc it creates.
Now, you might hear global warming and think, hey, milder winters don't sound half bad. And it's true, there could be a small benefit, like fewer deaths from things like pneumonia. But here's the thing, that tiny sliver of good news gets absolutely dwarfed by the other side of the coin. Extreme heat from heat waves that are getting more frequent, way more intense, and lasting much, much longer.
And this isn't theoretical. This stuff is deadly. Just look at the heat wave that hit Europe back in 2003. A single event caused over 22,000 extra deaths. And it's always the most vulnerable, our elderly and people with chronic illnesses, who pay the highest price when the mercury skyrockets.
And it's not just heat stroke we have to worry about. This is what's truly startling. Research shows the risk of having a heart attack starts to climb as soon as the temperature gets above 20 degrees Celsius. That's just 68 Fahrenheit. For a lot of us, that's a perfectly pleasant spring day, and the risk can spike in as little as 1 hour.
Of course, the heat doesn't just get to us directly. Think about what heat and drought do to a landscape. They turn it into a tinderbox. The smoke from these massive wildfires is this toxic soup that can travel for hundreds, even thousands of kilometers, and it's estimated to cause around 339,000 deaths across the globe every single year. And that smoke, it's the perfect lead-in to our next big point. Beyond the visible danger of fire, climate change is fighting an invisible war on our health by poisoning the very air we breathe. A warmer planet literally cooks the atmosphere, creating more pollution.
There are two main villains in this story. First is ground-level ozone. It actually forms because of warmer temperatures, and it's absolutely brutal for anyone with asthma or other lung conditions. And then you have what's called particulate matter, or PM 2.5. These are microscopic particles from things like wildfire smoke. They're so ridiculously small that they can bypass your body's defenses, get deep into your lungs, and even slip into your bloodstream, causing plaque in your arteries and triggering heart attacks.
Now look, both of these are bad news, but they are not in the same league, not even close. This quote from the research is, well, it's just staggering. The risk of premature death from those tiny PM 2.5 particles is about 15 times higher than the risk from ozone. It's an incredibly dangerous threat hiding in plain sight.
Okay, so we've got the direct hits, right? The heat, the bad air, but that's just where the story begins. These initial problems set off a chain reaction, a cascade of other crises that ripple out and touch every single part of our health systems.
First up, the absolute basics for survival are under threat. Droughts and wild weather patterns are hammering food production. This leads to malnutrition, which the World Health Organization calls the single biggest health problem linked to climate change. At the same time, it gets harder to find safe, clean water, which leads to a huge spike in deadly diarrheal diseases, especially for young kids.
Second crisis,
A warmer world is a sicker world. It's the perfect breeding ground for bacteria like salmonella and cholera. And it's not just bacteria. Disease-carrying insects, like mosquitoes, can now survive in places they never could before. They're basically invading new territories, bringing diseases like malaria, dengue, and West Nile virus with them to populations that have never been exposed.
And this third one, it's something that millions of you probably feel personally every single year. More CO2 in the air and longer warm seasons mean plants produce way more pollen for a longer period of time. So if your allergies or asthma have been feeling worse and worse lately, you're not imagining it. It's driving up ER visits all over the world.
So, what does this all add up to in human terms? Well, the World Health Organization did the math to project the cost if we just keep going down our current path. And let's just say the numbers for just the year 2030 are incredibly sobering.
By 2030, we're looking at an extra 38,000 elderly people dying every year just from heat exposure.
Another 48,000 people, most of them kids, dying from diarrheal diseases because they don't have safe water.
An additional 60,000 people will lose their lives to malaria as those mosquitoes keep marching into new territories.
And then the biggest, most heartbreaking number of all, an estimated 95,000 more children dying from malnutrition as our food supply becomes less stable. That adds up to 250,000 extra deaths every single year.
Look, after hearing numbers like that, it is so easy to feel completely hopeless and overwhelmed. But here is the most crucial part of this entire story. We are not helpless in this. The technology we need to cut emissions and prevent the worst of these outcomes, it already exists today.
So it all boils down to this, really. The science is solid, the health consequences are very, very real, and the solutions are already in our hands. The problem isn't a lack of smart ideas anymore. It's about will, our will. Which leaves us with the only question that really matters. What happens next?